goes on, I'm seeing an influx of processed foods. Is there a correlation between obviously the chronic diabetes and hypertension and so forth, between all this the influx of processed food and those type of diseases? You're seeing an influx.
Well, yes, but the correlation between the foods you're talking about and diabetes and hypertension is that you have people tend to like salty foods somehow or the other, or they either laced with sugar or they laced with salt. Okay, and using these things over time, you're going to have problems with your blood pressure. You're going to have problems with your diabetes. The majority of patients we see are either hypertensive or diabetic. You know, we are so busy with these two categories. It's difficult to deal with other things. You know, people still suffer from other conditions like lupus and so on. But you know, you can diagnose those. But we're overcrowded by diabetics and hypertensive. We do offer other solutions. We had when I was working at the polyclinic, we had a nutritionist twice a week on Tuesdays and Fridays. Just one nutritionist. And I think that was overbearing. I think you should have at least 5 nutritionists. You should be there every day, you know, because if you get people coming in every day to receive nutritious advice, you know, because the ministry has a unit, they do a lot of health promotion, you know, but the thing is that's not disseminated to every polyclinic. Because if you only have twice a week, you're not getting that information out there. Because I see some of the health promotion posters they do, it looks good. It looks good. But the problem is for persons to afford that type of food. You know, you see some nice foods there. You see pumpkin, you see cassava, you see a whole range of foods. But for the average person to afford those foods, it's difficult, you know, and for the ministry is doing a half a job. They're actually doing the health promotion, but I don't think it's disseminated to the wider population. And the government is not doing enough to make those foods available to the general population. So you will see an increase in chronic diseases, okay? Because let's say you go to the accident emergency, you're there with a relative, and the only food that's available is from a snap machine. And these snap machines are loaded with high salt and high sugar foods. You know, packer, tea times, you know, high sugar. You know, so they're not healthy foods available, right? We need to change that. We need to definitely change that.
You've mentioned schools. We have another special guest here, Mr. Alwyn Babb, and he would have done some coaching in schools. That is correct. Yes, please. Well, you mentioned nutrition in schools. I know when I was going to school, you know, in terms of training, it was heavy on training with any type of sport. Is that still the case? Are you finding that you know, the youngsters are a little unfit in these particular times?
Let me just clarify something. I'm within the school. I'm a physical employed as a physical education teacher.
Okay.
So most of the times we get confused between the coach and the physical education teacher. The physical education teacher is responsible for giving the why and the how. The coach then takes that from the classroom and refines it into what we see on the track or what we see on the football field or cricket field. So I am a physical education teacher who has a passion for coaching.
Beautiful.
Right. Within our school setting, the physical education is not seen as a department. We're tacked on to any department that is at the whims and fancy of the management of the school. So what we're talking about here and discussing among ourselves is about education. Where does education start? Within the school.
Right.
But then we're not talking about the problems that present themselves as adults who come into the polyclinics and our healthcare system. So we have to have a revamp of our education system. If we're talking about educational reform, it must define clearly for everybody, and everyone to understand the difference between the physical education teacher and their role and the coach and their role. So that when we are presenting our information from our texts, we now see that the subject is now tested at CSET and CATE. So it is high time that we stop playing the lip service and we treat physical education as the core for developing a healthier nation.
Definitely. And I agree with that. I know that when I was going to school, in terms of physical education, especially CXCs and so forth, that was not a thing from what I can remember. So it's good that that is starting